Welcome back to another episode of Questions with Crocker with me, Dr. Crocker, an emergency veterinarian and practice owner. And I have a special guest today, a different co-host than my husband. So Dr. Davis is here, and she is going to introduce herself in just a second. Just want to mention that if you want to watch us, you can watch us on YouTube. We did our makeup and we're ready to go. And then you can listen to us on Apple or Spotify, wherever you listen to your podcast. And we would love any sort of review or feedback during the episode that you want to leave us. So check us out on there and on socials at Questions with Crocker. And thanks for being here. I have to make sure I check all those boxes. So Dr. Davis, if you can let us know a little bit more about you before we jump into it.
Thank you so much for having me, Dr. Crocker. I'm so honored to be here and be able to be a part of your podcast and to talk to your followers. I'm Heather Davis. I graduated from Auburn University's vet school, War Eagle, and I went on for further training in equine surgery. And then after a period of time, I transitioned from doing that and teaching at Auburn and came to work for PRN PharmaCal. And so now I have taken practice to a little bit broader scope as far as working as an industry partner for our both development of drugs for dogs and cats, but also supporting our commercial team as we launch products out into veterinary medicine.
I love that. And as a former equine vet myself, horse girly, that's probably why you and I have enjoyed talking to each other even before the show. I am really excited today because we're talking about cats. And an interesting thing, because I do a lot of social media education, is there's actually a lot more cat owners that are looking for information on social media, and there's a lot less information out there for them. So I'm excited to talk about, in general, some cat issues, especially HCM, which we'll get into what that is. And then we have a big veterinary following too. And I think that, you know, in the past, especially when we're talking about cats and heart disease specifically, it is something that we maybe don't have as many options for, and is a little frustrating and, you know, sad to give clients the diagnosis of. And so I am excited to talk more about it, just how we can maybe find it faster. And is there anything else that we can do for these cats in the long run? And because I was saying cats so much, my cat, Mr. Bobby, has decided to join us. My left arm is not going to be able to move until he decides to be done napping. But he's also interested to hear more about it. So you're the expert. Can you give us a little rundown on what HCM is and how it affects cats?
Sure, absolutely. And I think one thing that is really neat about where we are in veterinary medicine, much to what you just said, is it's the year of the cat. And we have watched and seen how a lot more focus is coming towards equine medicine or feline medicine, and really how do we be better partners and better companions for them, but also just stewards of their medicine practice. And so HCM, or hypertrophic cardiomyopathy, is a perfect disease that to look at kind of how cats sometimes are not the greatest at showing that something is wrong. And so when they're presenting to the clinics, and I'm sure as now an ER doctor, you see it traditionally in veterinary medicine, when we've seen cats affected with HCM, they present with horrific things, either arterial thromboembolism, or the cat was fine earlier in the day and now they have congestive heart failure. And so I think that when we're looking at HCM, recognizing the fact that where we're starting from is not a great spot, but there's a lot to learn. So the disease process itself is an abnormal thickening of the ventricular heart muscle. And so it does not allow the heart to relax as it should, to allow the ventricles to fill, but also because it's abnormally thick and that muscle is so large, the only way that muscle can get bigger is by taking up space in the ventricle. So there's not a lot of space for the blood flow to go through that left ventricle and then out into the body. And so then it ends up backing up into the lungs, and then, pooling in the left atrium and causing, setting you up for the perfect storm of that emboli formation, or actually clot formation. Sorry.
No, that was a great rundown of it. And I will echo what you said. I mean, I will have so many cat owners run in, and I mean, these cats are lateral, or they are, cold and have a low blood pressure, or they just are not pushing blood through their body and oxygen like they need to be. And you're right. The owners will say they were perfectly fine this morning. And I think that's the hardest part of HCM is, in dogs, we have a pretty good correlation with, if you're doing routine exams and you're catching heart murmurs, then you're picking up on heart disease a little earlier. And then you're able to maybe do some more things preventatively, right? We can't cure it, but we can do some things to maybe slow down the progress and help the heart not have to work as hard. In cats, a lot of times you don't know. And the statistics around them actually having like a murmur and having heart disease are actually much, much lower. And so I'll have owners even say, well, I was at my vet last month for my wellness and they didn't find anything. And I think that's a valid thing. But unfortunately, this is a disease that you're not going to find unless you're really looking for it. So quickly, I had a couple people ask me about prevalence. And so at D_A_92 said, is there any prevalence in breeds in your experience that are not listed on the web? And I know that there are, like, I think of naked cats when I think of HCM,
Yep.
right? Sphinx cats. Are there any others that you think of that are really common or ones that maybe aren't as common that when we're seeing these cats in the, and I would say it should be for any cat, but
Yeah.
specifically these, right? That we should be having this conversation more?
Right. So the prevalence is actually 1 in 7 cats, which is a large number of cats when you
Wow.
stop and think about it, especially if you're a high volume cat practice. But to answer your question as far as specific breeds, the Maine Coons and the Ragdolls are definitely represented, and they also are the ones that have that genetic component to it that most breeders now will be checking for it to see if they are positive for that mutation as far as, in their litters that they have. So what we traditionally tell people is a lot of the fancier breeds, if you're into the specialty kitty population, is that you should probably be more aware and be more mindful that you might need to screen those more regularly or sooner in their life.
So when we start to talk about screening, I think that can also be a little tricky
Mhm.
because, in my experience, probably doing a cardiac ultrasound and actually looking at the heart is one of the best ways to catch it if you know how to do that,
Right.
right?
Yeah.
But and in the ER we do train on that, and I would say every cat that presents to me in some form of respiratory distress, I'm worried about a cardiac event, I'm going to be doing a POCUS on the chest and I'm going to be looking at that heart. So I feel pretty comfortable with that. But I did have at Sarah_Diaz said, should we be screening for this at preventative appointments? And I think that's a great question. And then also, what would we recommend if we're screening for it with these guys? Because one point is, like you said, the heart wall gets thicker internally, so you don't even see the cardiomegaly on X-rays,
Mhm.
right? So what would be your recommendation with the GP practices that want to be more progressive in their screening?
So I think that's a great question. And I think it all goes back probably to the basics of what we were taught in veterinary school. And that's a really good physical exam to start with. Number one, listening to the cat. And I know that sounds like basic, but also, and as you know, as soon as you're in the room and you put your stethoscope on the kitty, it seems like it's a signal for somebody to start talking. And so a lot of the cardiologists, and when you actually get veterinarians talking, they're like, yeah, I don't know if I'm actually listening long enough to these kitties. And so when you are assaulting these cats, really taking a listen, because if you hear a murmur, now that we have something that we can address a condition for, you should pause and be like, okay, so now I need to start thinking about what other diagnostics I should do. So making sure that you're listening thoroughly as well as long enough. The other thing in a general practice would be running routine blood work. And I know that on cats, if you ask me, would I rather sample blood from a cat or a 2,000-pound angry stallion? I'm going to say stallion every day. So,
100%, 100%.
but grabbing that systemic blood work for them to be able to rule out other conditions. So it's always important, as you know, to rule out other things like dehydration, hyperthyroid, and making sure that you're checking those other boxes to make sure that as you kind of rule down into HCM, to determine that that's your diagnosis. The other thing that you can run is and a lot of depending on how you test this in your clinic, would be an NT-proBNP. And people have
Mhm.
different thoughts and feelings about that particular diagnostic test, but I think it's an important, you're stacking your odds as either ruling it in or out. And so I think that that's always an important aspect to include as well. And then once you get that, really sitting down and looking at the blood work and assessing it, and then going to the next step. As the our echocardiogram is going to be the gold standard for truly
Mhm.
diagnosing it. But I also understand that that's scary. You know what I mean? To
Mhm.
either, if you haven't been trained, or grab CE. But I think what's really neat is that now, with a rotating cardiologist or the CEs, that you can be able to educate yourself on to give you that comfort level, depending on where you're practicing and what your demographics like. But I think it's going to require us as veterinarians to put on a little bit more of a thinking cap to be able to look at the cat as a whole picture.
So, from what you said, I would say good physical exam. Now, if you don't hear murmur, you're not necessarily ruling out heart disease in a cat. But if you hear one, you definitely want to make sure you're following up
Hmm.
and you're not just saying, "Well, recheck this in 6 months," right? And then the other thing is knowing your breeds and knowing which ones you probably need to be recommending that more routine screening. We definitely do at my general practice have a traveling cardiologist that comes in once a month, and we set appointments, and we have some that he just does some cats that the owners want to routinely screen them.
Hmm.
And I love that. And I love being able to offer that as an option. On the blood work, I agree with you that the proBNP can be helpful. And so for people that don't really know what that is, and I'll try to explain it. You correct me if I'm wrong. But it would be, I would say it's like a cardiac enzyme that would be elevated if the heart is working harder than it should
Hmm.
be. That's kind of how I explain it to
Yeah.
owners. But if it is normal, that doesn't necessarily rule out heart disease, because it could just be that the heart is not compromised enough
Right.
that you're seeing the elevation, right?
Absolutely. And I think that that's, we want, and unfortunately, in this disease process, you want to say there's one thing that's going to be able to tell you, that this is HCM. And that is,
Mhm.
echo is going to get you there. But taking everything else, if that's not at your access, taking everything else into account. The other thing you can do is check the cat's blood pressure. And I feel like most kitties, when they're in the clinic, their blood pressure is probably not
Yeah.
normal between being away from home and then the white coat effect. But it is something that, as far as when you're ruling in and or out other conditions, it's very, very helpful.
Yeah, I agree. And I do think we got a Doppler recently, and we will actually go in the room with the owners and
Hmm.
have them like feed churro and have the cat kind of lay there and try to do it in as low stress as possible of
Hmm.
an event. And we also try to do Doppler blood pressures, or blood pressure in general, before we are drawing blood and getting urine and all the other things that would cause them to be more stressed out. So all those things are certainly helpful. What you said, 1 in 7 cats. Is there an age prevalence that we need to be looking at too, where we're really keeping an eye on these guys? Because I feel like I've seen some really young cats
Yeah,
with really
right. And
thickened hearts.
yes, and there's not really an age prevalence, but there is a sex predilection, and male cats seem to be more overrepresented in that particular aspect. Yes.
Yeah, it's like me sitting here with my male cat, and so of course, he's a veterinarian's cat. So he already
Hmm.
has urinary issues, and I check that all the time. But now I'm like, okay, so now I need to set up regular echoes, like your head starts. I feel like that happens when you're a veterinarian. Like you see the worst of the worst. And so you just are constantly diagnosing your pets with things or worried about things with
Oh,
them.
for sure. I can completely relate. Now have a punch card with my small animal orthopedic surgeon, because my dogs are just, it's one ACL after another. And I'm like, guys, you know what I mean? And once you start and down that track, but I think that, I'm hoping after maybe the fifth one, he'll cut me a deal or something, like
Yeah, I was going to
Subway.
say like the punch card.
Yes.
Yeah, that's so funny. Wait, what kind of dogs do you have?
I have Rotties.
Okay.
I've had,
Well, okay, you have Rotties, so I can
yes.
see that we're having more ACL issues.
Yes, yes, I have Rotties, and I have had Rotties for a long time. They have been a part of my life, and I think that they're smart and they're loyal, but they're also a little bit lower energy. You know what I mean? They're not trying to be too wild and crazy. They have about an energy for about 5 minutes, and then they want to nap the rest of the day. So that's
Then
my
they're good.
speed. That's definitely my
I
speed.
love that. I love that. The big dogs that like to be couch potatoes
Mhm.
are perfect.
Yeah.
So I did have another question that I thought was good with what we were just talking about. So at hope.dbm24, hi Hope, said GP brief echo tips. Is there any that you can give when the owners can't be referred out? And I would tell you, because I've done a lot of ultrasound training, there's so many options to at least learn the basics,
Mhm.
right? What do you think? I mean, what level of skill does it take to truly look at a heart and say that wall is really thick or not?
Well, I think that, getting that right now there's so many different trainings in CE that you can sign up for or be able to either go and learn or to educate yourself as far as the technical aspects of it. But there's also different contexts as far as sending your ultrasound off if you're
Mhm.
not sure, and getting either a radiologist to read it or a cardiologist. And so I think just being brave and trying a continuing ed to get that additional knowledge and knowing that there is going to be there's going to be a little bit of a learning curve, but
Right.
now that we have something that is a disease modifying agent that we can treat these cats with, challenging yourself to be like, this might be a little bit weird and uncomfortable to learn this, and I might not get it right, but finding somebody that you can send those off to, if you're not sure, as a second check, I think would be great. So I think it's probably going to be variable depending on how comfortable you are with the probe, and I would err on your expertise for that. But I think
Right.
in this day and age, as far as with this disease and now having this, it's worth us pushing ourselves as professionals to be like, even if they say, "Wow, this is really bad, you might want to try this again," which is
Yeah.
always my
Yeah.
fear with a
You still
radiologist.
learn,
You know what I
right?
mean? And just
Yeah.
know that you're not going to probably crush it every time, but you're doing the right thing for the pet to try to get, to get a diagnosis. I think that the cardiologist would definitely support that.
Yeah, and cardiologists are amazing and I appreciate them, but it's not always easy to
No.
get into a cardiologist, a veterinary cardiologist. So having the capability to at least do minimal screening, like I'm not taking all the heart measurements and doing all the things. I am literally looking for big, bad, and ugly when I do it. But I would also say, if you're interested in doing more cardiac ultrasound workups, just having everyone in your clinic bring their dogs, bring their cats
Mhm.
in, and working on where the window is and where you can really see well and what is more normal looking, right? And then you kind of get where you stick that probe on and you go, oh, like that one is not,
Uh-huh.
right? And so I agree, like some of the big conferences actually have the wet labs where you can go and you can just practice a lot on pets and have someone right there. But I did virtual training and I had someone on a webcam and they're telling me, okay, rotate the probe this way, do this. Okay, we're going to take these shots. We're going to measure like this. And even just having that level of support, I learned so much. And then it's just practice. It's just
Yeah.
practice and you train your eye a little bit. But I do think that being able to offer that, more routinely, hopefully we can catch more of these cats because, like you just said, we do actually have more options for them. So, I mean, really in the past, I had to tell an owner the muscle has thickened. There's really nothing you can do to change that. And so this is not compatible with life. I mean, in the ER, I'm having that conversation a lot, right? So at Kimmy_33 said, what are the treatment options? So, Dr. Davis, let us know.
Well, so I think that, much like you just said, up until now, if you diagnosed a cat with HCM and they weren't showing clinical signs, they were in that subclinical B1, B2 classification, it breaks my heart because even as a veterinarian, to be able, had to have a conversation with your client that this is what it's most likely is, but now we just have to sit and wait until your cat
Mhm.
starts to show signs of congestive heart failure or gets a thromboemboli, and that's heartbreaking for the vets, that's heartbreaking for the owners, and then they're just kinda looking at the cat like, you know what I mean? You're as far as that
Mhm.
human-animal connection, and so now, and of course, then when they start showing clinical signs, it's all symptomatic treatment, as far as managing the congestive heart failure or the thrombotic emboli. Well, now, with the conditional approval of Felycin-CA1, there is a product on the market that actually is addressing or managing the thickness of that ventricular wall, and decreasing the size of it, which we have not seen before, which is very, very exciting.
It's very exciting. I feel like things that give us hope like this, that we can actually, save these cats, especially the earlier we catch them, the better. My cat is waking up and snuggling me more because he's also very excited. But I do think that, word is starting to spread a little bit more about it. And I will be honest, when I was walking around the booth at the conference, because that's where I first heard about it, and, I walked by the PRN booth and I saw the sign and I was like, a treatment or an option for HCM? Like, this just doesn't seem real. Like, it doesn't seem like this is possible. So I did want to know more about it. And at MS Pines also had heard about it because she said, tell me all about Felicin. So where did this come from and what has been the trials on it? And is it available yet? Because I was told it was still coming soon when I did visit the booth. So let's run through some of that.
Perfect. So Felicin-CA1 was originally developed by a company called Trivium Vet, which is an Irish company, and you can visit them on the internet and see them. They're an incredible group of individuals, heavily feline medicine focused on building out drugs in a portfolio that serves the kitties. They're our company, PRN Pharmacal and Pegasus Laboratories. We are now one company, which is great because we have expanded our team into the feline medicine. But they did the studies they did for Felicin-CA1 is number one, they wanted to make sure it was safe, right? You never want to have a drug on the market without making sure it's safe in the target population. So they did the steps necessary to determine the dose that would be able to manage the course of the disease while also being safe. And so they got it down to a dose that is appropriate, which is wonderful because that dose is, and they're a nice convenient dose banding. So it's one tablet once a week for cat owners. And so when you think about the other products that you would be administering to a cat when they get congestive heart failure, that's multiple times a day. And so if you can diagnose it early and you can start them on Felicin-CA1 once a week, as far as administration. And the question we get a lot of is, well, how big's the tablet? It's a Tic Tac. It's about the size of a Tic Tac. So pretty easy to administer. So they did the studies to make sure that it was safe. So they evaluated it at various doses, and then they evaluated over a long period of time where they did a dose escalation. And what was great in that study is that the adverse events that they saw, the primary one that they saw as far as the safety concerns were slightly elevated liver enzymes. And when they looked at the cats after that study, there wasn't any evidence of liver failure like you would see with phenobarb or anything like that.
Mm-hmm.
The livers were normal, both histopath as well as on growth path. But what they realized is that the actual active ingredient in Felicin-CA1, which is sirolimus, asks the liver to work a little bit harder. And so that's what causes the liver enzymes to be elevated. And what that means is...
I will
Yeah,
I
sure.
will
No,
tell
go
you,
ahead.
I work with a lot of young veterinarians, training them in the ER. And I mean, they run like INTED panels and everything, and they're like, the ALT is 130. And I'm like, listen, you just look at the liver and it gets pissed off. Like the liver, like the
Yes.
liver values need to be pretty high, for me to be like really concerned. Because, and sometimes honestly, the benefit of the medication is still worth any potential side effects, right? Because
Right.
this is a deadly disease. And one other thing I was just going to add real quick is one of my main questions was, what was the dosing and how frequently? Because I tell people all the time, yes, I have things that can help you, but if you cannot get it in your cat,
Mhm.
or if it's stressing you and your cat out to give them medication, there is a balance there. So once a week is actually incredible that
Yeah.
that's all it takes
Yeah,
to give this.
and it's a really neat way that the drug works. And so yes, once a week. And the liver enzymes, when they elevate it, some cats the elevation might be quite large, and they don't really have a way to explain it. But based on, depending, it might be a breed or age predilection. But what we do know is it doesn't cause liver failure, and it doesn't either have gross or histopath findings, which is great to know. But what it
Mhm.
does mean is before putting them on the medication, we ask that the veterinarian screen to make sure the liver is okay. But hopefully, in your process of diagnosing, you have already
Yeah.
done a chemistry. And then we ask you to recheck it in 6 months and just make sure that the liver is okay. And then if it's elevated, then we ask you just to recheck in another few months to see if the liver has adjusted. And most of the cats, it will adjust and go back down and it'll be fine. If it doesn't, then the cat is just not going to be compliant. The cat's liver isn't going to process it appropriately. Sirolimus, or the active ingredient in the product, is also a autoimmune molecule. And so what they also wanted to make sure for safety purposes is make sure that kitties can still mount an immune response and get vaccinated accordingly. And so
Mhm.
they did prove that, despite the fact that that's what that molecule does do, that the cats will be able to mount an immune response, which is important. So that's the safety side, which is great. And we've met those standards under conditional approval. The other side is the effectiveness side. So conditionally approved products, the only difference between a conditional approved product and the fully approved product is the work that goes into developing on the efficacy side. And so the effectiveness, and they call it effectiveness, it just means that the amount of work that went in, it was a pilot study, it was a smaller cat population. But in addition to that, Trivium Vet included a robust amount of literature that was in other species that showed where the product was effective for treating hypertrophic cardiomyopathy in rats and in humans. And so that supplements that data. And so what they were able to see is that in the course of their effectiveness study, which was called the RAPICAT study. And so for those of your viewers that have access to JAVMA, it's been published, and highly recommend reading it if you're curious. But that particular study showed that there was a decrease in the treated population as far as in the maximum wall thickness on that left ventricle, which is good. And then it also showed that in the placebo cats, the wall thickness, did continue to increase. And so a really good positive effect as far as that. So those are the two sides of the in-life development that got Trivium Vet to approval. Oh, and
And so it
sorry, go ahead.
okay. So it would be a lifetime medication,
Yes.
ideally weekly. It's
Yes.
not like you treat it and you don't have to treat anymore. You're going to try to maintain these cats, and this is what's going to do it
Yes.
going forward.
Yes. And
Okay.
probably the most important question that you ask, and that I buried the lead for sure, was yes, it's available through all your distributors. I'm
Yeah.
pretty sure my sales and marketing department would be like, you should have said that first. But so
No, you're
yes,
good.
it's now available through all your distributors to be able to access.
Do you have an idea? I mean, I know pricing is going to be very all over the place, right? But when we're talking about a lifetime medication, I always want to consider that. And obviously, a cat owner, I feel like, that has done all the things and done the workup and wants to be super thorough, they're going to be wanting to give this medication. But is it going to be something that's like thousands of dollars a year to treat the cat? Is it a weekly pill doesn't sound like that much overall, right? And you might not even know and just say, talk to your distributor or your rep or whoever. But I just didn't know if we feel like the pricing falls where it is reasonable to treat a cat for 5 years on this medication.
Yeah. So I will always say you defer to the sales
Mhm.
rep and your veterinarians, because the pricing is different and then SKUs will be different.
Mhm.
But what I will say, it is very, very affordable to the client.
Okay.
And it's sold in 3-month packages. And so when you
Okay.
get down to the weekly, it's well within affordability for a feline owner.
I love that. I love that. I think that, and I'm the type of person that is like, if a pet doesn't have to be on a medication lifelong, there's always options to try to see if, direct shipping works, or,
Mhm.
I want to make sure the pet gets the medication. I think that's really important. And especially if an owner's done a good job of working them up and, listen to all those recommendations we've made that honestly can be hard to get your cat back and forth to the vet and
Mhm.
do multiple tests and get an echo done and do all the things. So I think, you want to try to support those people and the cat as much as you possibly can. So
Oh,
I
absolutely.
love it.
Absolutely. I think once the diagnosis is made, and then depending on the practitioner, as far as how they want to check in and up on that patient,
Mhm.
going to a direct to ship is great. I love it because it's on autopilot for me, and I think that
Yeah.
it's super helpful as far as maintaining that compliance. So, absolutely.
Is the tablet flavored, do you know, or is it
So
unflavored?
that's a unique thing about the tablet, and so when you see the box, it says delayed release, and what that
Okay.
means is that the tablet is coated. It's kind of like a M&M coating, and
Mhm.
the tablet needs to be administered whole to the cat. No
Okay.
chewing, and then don't give it while it's eating. And why that is because the outside coating of the like on the M&M protects the active ingredient from the stomach acid, so that when it passes through the stomach, it can be absorbed in the small intestine. And so you want to make sure that, like I said, you give it whole, either with a pillar or however it's easiest for you to dose your cat that way. And then just we say in a fed state, and there's not a particular time, but typically kitty owners know when their cat eats, and then
Yeah.
so within an hour or so afterwards, then administer it. So and that food enhances the absorption of the product, but it's important that the coatings stay intact.
Yeah, I mean, I don't think I even need a watch because my cat is like, "Hey, it is time." Like, he's sitting here right now like, "What do you mean you're
Look at
talking about
that. I
me?"
love the
Look at his
face.
face. He's like, "What in the world?" No, but he lets us know when it's dinner
Oh,
time.
that's a
It's not 1 minute past, right? The time. No, but it is good to know that it needs to be given whole because I love my, cat owner clients, but sometimes they're wild with like, "Can I mix it with this? And can I crush it up and do this?" And so it is really good to know that. My tip and trick, and this is not PRN recommending this, but I like to take, butter and, like, put butter and freeze it really fast, and so there's a little, like, butter it's like a little butter ball, and then you can, like, pill really easily with that too, but you'd have to see how big it is and what your cat tolerates, but that works great for me when I have to pill my cat or other cats. So, is there anything else that is a common question that is asked about this or HCM in general? I mean, it's only been out for I mean, a year, if that? Not even that?
It was improved in March, and it went
Okay.
into on the market around June, and I think out to everybody in July. I think the most common question we get is what can owners do at home? As far as to monitor their cats. And so, one of the things that we have started telling people is one of the best things that you can do is monitor your cat's sleeping breath rate, and the importance of that, because as that breath rate increases above 30, that's sign of clinical progression of disease. And so I think in this particular situation where kitty owners were going from not knowing anything was wrong until something being terribly wrong, um, being willing to either video it with your phone and then count it, or whatever, but be able to keep an eye on the progression of your cat's disease so that hey, I think that we're getting into a spot where that you need to consider something else. But that's probably one of the most frequently asked questions
Mhm.
that we get.
Yeah, I mean, I actually I feel like I walk by my cat all the time while he's napping, and then I just kinda watch him for a little bit and watch his breathing, and, I check breast rate so much that I don't always, like, time it because I feel like I just kinda know if something is more rapid, but I tell owners, like, the worst thing that would happen is you say, "I think it was a little high, but they're fine otherwise," and you bring them in for a check, and maybe your vet says, "Everything sounds great, and they look great," and, you say, "Cool," and you don't but what if? Like, what if that one little, breathing a little faster catches, a disease like HCM, and then you can go on a medication weekly that is going to
Excuse me. Sorry.
bless you. No, it's okay. It's okay. But, what if you do catch it early? And then what if you can go on a medication that will truly extend your cat's life? Like that to me is incredible. So I do, if there's any pet owners listening, I really do encourage them, even if they feel like maybe they're being like a crazy cat owner, like be the crazy cat owner
Mhm.
and go in and take your cat in, because the worst thing is they might say, cool, they look great and you made a visit for nothing, but at least And if they do catch something, we actually have something now that we can do about it. So I love that, because this is a disease that has made me cry and made a lot of people cry in the ER. So I'm going to be setting up my cat's echo in the next month now.
I think I love that, and I think that you're right. I mean, especially with as close as the bond as depending on whatever that relationship looks like. If it's a pet parent, or that's your emotional support, or whatever it is, I think it's worth that trip to the veterinarian. The other thing I would add is that this conditional approval for Felycin-CA1 is just the first step.
Mm.
Trivium is actively enrolling in a much larger pivotal study on the road to full approval. And in that pivotal study, and again, if you go on their website, you can see where their sites are, see if your cat's, your cat potentially may be able to be enrolled in the study and help them in their mission as far as to raise awareness, but also get to full approval. But the great thing about that study is it's a much larger cat population that they're evaluating.
Mhm.
They're also evaluating additional echo measurements. And so at the closure of this study, there's going to be so much more scientific information that we're going to have as practitioners, both on the use of the product as well as the potential efficacy of the product. And I think that, as veterinarians, we're constantly learning. We can't help but
Mhm.
that. And so that just as a heads up that this is the initial approval is the first step. There is something ongoing that is going to help us, get to that full approval and, raise awareness of this disease.
I love that. So if people are going to be going to that conference soon, PRN usually has a booth and you
Yeah.
could connect and find out more about it. I'm sure that there's going to continue to be webinars and informationals put out there about how to talk to your clients about this, how to best set up preventative screening. But maybe this little step will help us get the Felicin into a couple more clinics and help more cats, which is, ultimately the goal. So I really appreciate you being here today. And if people want to, do you have a social media you want people to follow you on? Or is there any way, if like veterinarians have questions, that they can reach out to you?
Sure. I am on Instagram, and it's Titanium Pegasus.
I love that. Wait, do you want to tell me what that? I feel like I
Sure.
need a backstory now, Dr. Davis. Like that was unexpected. I'll be honest. I need a little backstory.
Oh gosh, I was not expecting to share this.
I know. Sorry.
When I started the Instagram account, my hair was titanium blonde.
Okay.
I also had a mohawk at the time,
Okay.
and
All of this knowledge, I'm loving all this. Just so you know.
Pegasus was where I was going to work. They're the parent company for PRN PharmaCal, and so
Okay.
that I at the time I was like, this sounds like a great idea, and then I just
Yeah.
have stuck to it. So.
I love it. It sounds like a great branding opportunity, in my opinion.
Well,
So
thank you.
yeah. Well, I really appreciate you coming on. I appreciate all the work that PRN is doing to educate people about this and to actually try to help these poor kitties. And I do encourage anyone. I think sometimes in vet med, we hear about new things where we're like, well, we'll kind of like see how it goes and, how, but this is one of those things that I'm like, what do you have to lose by trying it? Like, you literally have nothing to lose, because these cats, if you do nothing, are going to pass away from this disease. It is a very aggressive disease. And so for me, it's one of those things of, if you're sitting there saying, well, maybe I would want, no, like you should be trying this, because if it even helps one cat, right, in your practice, like that to me is going to be valuable. So I'm excited to get some. I'm obviously going to have to talk to PRN about that. And I'm excited it's available. And if you guys have any additional questions, you can reach out to Dr. Davis or me. And again, follow us at Questions with Crocker. Thank you so much for being here today. And you guys have a great week.
Thank you for having me.